Hello everyone, welcome to another episode on our discussion about menstruation. I am Keiza Adumakwa, your facilitator for this session. Today, we delve into dysmenorrhea, also known as painful menstruation or menstrual cramps. When your period starts, your uterus contracts to shed its lining. That's the blood you see. Those contractions are controlled by a hormone called prostaglandin. When your body produces too much of it, your uterus contracts harder, squeezing the blood vessels inside. That's what causes those painful cramps. This is called primary dysmenorrhea, and it is the commonest type. It's not caused by any disease, just how your body reacts to its own hormones. One may ask, can this be avoided? And the simple answer is, not really. But it can absolutely be managed. The most common treatment is pain relievers called NSAIDs, like ibuprofen or naproxen. I believe you are familiar with this class of drugs. The NSAIDs, we covered it during our gastric ulcer education. Hence, they are contraindicated that is, they are not recommended for patients with peptic ulcer disease. These NSAIDs reduce the prostaglandins, which means fewer contractions and less pain. It's best to take them as soon as you start cramping, and always after food to protect your stomach. Notwithstanding, ladies with peptic ulcer disease experiencing dysmenorrhea can take paracetamol, that is acetaminophen, to manage milder pain. One may also ask of other ways to manage painful menstruation, and below are some that I have gathered for you. Use a hot water bottle on your lower back or abdomen. Get extra rest. Avoid foods that contain caffeine, such as energy drinks and Nescafe. Avoid smoking and drinking alcohol. Let your closed body massage your lower back and abdomen. You can even do it yourself. Exercise regularly and also eat a balanced diet, especially anti-inflammatory foods like leafy green, vegetables, ginger, and nuts, and drinking green tea. There is also another type called secondary dysmenorrhea. This one is different because it's caused by an underlying issue like endometriosis, fibroids, or a pelvic infection. I know you have this big question on how you can tell the difference. This is why I'm here. If your period pain starts earlier than usual, lasts longer, or gets worse over time, and regular painkillers no longer help, that's a sign it could be secondary dysmenorrhea. In that case, it's important to see a doctor so they can check and give proper treatment. Now, here is something interesting. Did you know that girls who start their periods very early are more likely to experience dysmenorrhea? That's because when you get your first period, what we call menarche, at an earlier age, say before 12, your hormones become active sooner. This can lead to stronger hormonal activity and in turn, stronger period cramps. Girls who start early also tend to have irregular periods for the first few years. That's completely normal. Your body is still adjusting to new hormone levels. But the good news is that these irregularities usually settle naturally by around age 15 or 16 as your body matures. Once your hormones balance out, Your periods become more regular and cramps often ease up. You can manage the pain the same way we talked about, using pain relief, heat therapy, exercise, and healthy eating. But if your periods are still very irregular after age 16, or the pain is severe, or the bleeding is too heavy, then it's best to talk to a healthcare provider. So, should you be worried? No, not necessarily. Painful periods and early menarche are both common and natural parts of growing up. The key is to understand your body, take good care of it, and seek help when something doesn't feel right. So remember, dysmenorrhea might be common, but that doesn't mean you should suffer in silence. Talk about it, ask questions, and if your pain feels unusual, don't hesitate to visit a clinic. That's it for today's episode. TenaHealth Initiative, empowering teens and young adults through interactive learning.